Good evening, everyone. Welcome to our webinar, and we have a wonderful guest with us tonight, Dr. Chia from Malaysia, who's gonna do his expertise with Fotona on intraorbital tightening. He's gonna hopefully be able to show you some melasma pictures of some of his amazing results that he's done, and he's gonna be showing you the Super V. I'm going to be starting this webinar with just introducing you guys a little bit to the new Fotona family member, which is the Fotona Max. My name is Teresa Maloney. I'm the senior clinical trainer with Clarion. I've worked with Fotona for 15 years, and for me, watching what Fotona does and what they create is just amazing. And I want to introduce you just a little bit to something new that they've created on their system called the Fotona Max. So this is what we're going to start talking about first. So again, we're happy to welcome Dr. Lucas Chia here tonight to talk about his experience with the Fotona and the procedures that he does. And for me, what I want to talk about with you is the DMC cooling that is now available on the new Fotona Max. So one of the great things about this handpiece is you have spot sizes from 3 to 30 millimeters. You do not have to switch out handpieces from an R33T to an R34. This R35 will be able to hold all the spot sizes that you want to do for the treatments. But what we want to talk about is what is integrated into this new handpiece, the R35 NX. You have the cool mist spray, which we call DMC cooling, dry molecular cooling, and it is also available in the NX runner. For people that have the SP Dynamis, and if you have the scanners, there you would have the L runner. Here it is now called the NX runner. It's the same thing, but they just give it a different name, and they've added the DMC cooling. And of course, you have the temperature sensor so that it will do real-time sensor of the tissue as you're heating it up. So why is cooling important when we do our aesthetic procedures? It protects the epidermis by lowering the skin surface temperature before and after the treatment. It allows you to use higher influences, which improve the efficacy and target, deeper target heating, reduces the risk of epidermal injury and PIH, especially in higher Fitzpatrick skin types. It will improve patient comfort by minimizing heat and pain sensation. It stabilizes the thermal response for more consistent, predictable results, and it supports faster recovery through reduced erythema and edema. So the common methods that we tend to use in aesthetics and dermatology is cold air cooling, and that is your Zimmer that we provide with the SP Dynamis. You can use a cryogen spray cooling, and of course, there is always contact cooling as well. So the technology behind dry molecular cooling it uses a digitally controlled micropulse mist of air and water, combines air and atomized water molecules, and enables rapid evaporation, which equals fast self-regulated cooling, and maintains a skin safety, prevents overcooling. So the minimum temperature your skin gets to is 16 degrees Celsius. So it is very safe to use on the tissue. When you look at this is a chart of showing you the scanner with the DMC and showing you the scanner versus Zimmer. So the blue is the DMC and the red is done with the Zimmer. So this is trying to show you is that the DMC achieves a faster and more controlled drop in surface temperature within the first few seconds, reaching approximately 8 to 9 degrees below baseline. The Zimmer, on the other hand, shows a slower and less efficient cooling response with surface temperatures remaining higher throughout the same duration. So this demonstrates that when paired with the scanner, DMC provides significantly more efficient epidermal cooling, maintaining a safe and consistent temperature without overcooling. I've been using this for a while, and I find when I'm doing it for hair removal, they're not feeling any discomfort while I'm performing this treatment with DMC cooling. If you look here, you can see the thermal cameras of the different cooling devices that we use, the DMC spray, the cryo spray, and then of course you have the Zimmer. So when you look at it, this shows the system using water and an air about 5. So when you look at DMC, the way I'm going to give you an analogy here is that if you're sitting on a patio and it's hot and they have a fan going and they have a mist of water going and you have the fan, it just dries the mist up, but it keeps you cool in the process when you're in the heat. So this is a great way to describe the DMC cooling of doing this. And this is showing you using the DMC with the runner. Again, delivering the energy while the spray is going, delivering that energy and keeping the epidermis intact. And if you see it with the Zimmer, not as much cooling, not as much protection. And it's focused, blowing right here where it's getting very cold. So how does it work? Well, we know that we use FRAC3 for hair removal to destroy the anagen hair. But when you're doing this, you add in the DMC with it, it makes the treatment a lot more comfortable to have done. And you're going to see a video of here of us doing the treatment on an underarm. And again, when we did this treatment, there was no discomfort at all. And I think one of the things for everybody that's been in the industry forever doing hair removal, there is no sulfur smell, which is an indicator a lot of times that that's the smell of success. We're getting the hair. But it's also, you still see the sparking, you see it doing the proper hair removal. So that is what I wanted to talk to you about of the new DMC. And I am going to turn it over to Dr. Chia, who is going to talk about the non-surgical lifting with the Dynamis.
Thank you, Teresa. Thank you very much. Okay. Good evening, Canada. How are you guys doing? And it's such a privilege to be invited by Clarion Medical Technology to explore the brand new Dynamis a large topic, and I hope I could cover as much as possible in the next 30 minutes. Now, with the Dynamis, the possibilities are endless. Now, we have recorded, okay, more than 100 indications that could be performed with just a single system. Now, with the new arrival of Dynamis Max that is equipped with the DMC cooling, not only we could do exactly what it was meant to, and now we can do it better. Aging is inevitable. The appearance of the aging is not limited to the skin. Anatomically, it also involves the fat compartment, the SMAS, muscle, ligament, as well as the bone. Changes in the muscle include the muscle thinning and the lengthening, which further contributes to the facial sagging. Ligament is also another important structure, as its laxity lead to the soft tissue descent too. When bone resorption occurs, the ligament will undergo what we call the mispositions, leading to the migration and the droopiness of the fat compartment. We lose about 10% of our facial fat at the age of 35 from both the superficial and the deep fat compartment, and additional 5 to 10% and every 5 to 10 years after that, depends on the lifestyle. When the fat compartment migration causing these noticeable fat pockets, now this lead to the sagging skin, the eye bags, and the deep creases, leading to the formations of the nasolabial fold, the meridian line, and the jowl that's shown in this illustration, together with their associated ligament mispositions. Hyaluronic acid filler, and now these new collagen stimulators, they've always been the popular treatment. But we know that this is actually not the best treatment, as the underlying cause are not being addressed. With the advancing of the age, apart from the creases, the fat migration continue to worsen the contour of our face, which shift from an inverted pyramidal shape into an aging pyramid, with a blurring of the definition of the face. Now you check out this picture, right? Now we know that there is a descent of the fat compartment as we age. With time, the fat will undergo further lateral shift and even the anterior spill over, which further exacerbate the appearance of an overall aging. With all that we have discussed, we now know that the skin aging does not confine at the dermis with the loss of collagen. It is a multi-etiological and multi-layered problems that ranges from your ligament, the muscle, the smas, the fat, and the dermis. Visible and sustainable anti-aging treatment, we need to treat all these structures holistically and wholly. Therefore, about 2 years ago, I remember the Fotona China has designed a new protocol that is known as the 4 layers, 4-dimensional tightening and lifting. The reason number 4, all these 4 is used as it targets all 4 major layers of the skin structures that contribute to the skin sagging. They name these treatments as Super V. I need you guys to have an open mind towards what I will present from now as some steps of the Super V that I will talk later. It might sound controversial, might sound unreal to certain people, okay? Now, in order to understand what defines the aesthetics of the facial contour, we can imagine that there are two demarcations on our face. Firstly, the outer crown, which supposed to have a natural V shape. Then there is this inner crown, which I call it as a monkey king. As you look at the white line, it mimics the skull of the monkey. And lastly, there is a junctional zone between the two crowns. Our aim now is to volumize, tighten the structure and lift the fat compartments of the area inside the inner crown. For the outer crown, we need a well-defined contour and preferably restore the natural V shape. The junctional zones requires a smooth texture and the seamless connection between the two zones. And I was at a Starbucks the other day, and suddenly I felt inspired by the siren, the Starbucks girls, okay, on the logo. And you take a look at these two faces. Now, which one is more attractive? Needless to say, it is the one on the right side, okay, right? Now, the vertical heights of the faces, they are exactly the same. But the right side has a shorter horizontal width than the left, 2.6 cm versus 2.87 cm. So, excuse me, the right appears slimmer and more attractive. And these are how both pictures were when the image was captured from the top, where the right picture was folded. Now, this gives us a very interesting way to conceptualize the V-shaped beauty. If you draw two diagonal lines across the face, dividing into 3 zones, the larger the side zones, the flatter the face, not attractive. The smaller the side zones, the higher the folding degree, the more dimensional and the more attractive the face, just like our Starbucks girls on the right side. Now, this idea actually in line with the concept of the Super V, focusing on the multi-dimensional tightening. The fundamental of the Super V consists of 4 steps, all target at each layers that we've discussed before. Earlier, I urge you to be open-minded for this, especially the step 1, which is on the smash. Because up until today, I still do not comprehend if the laser energy could in fact photothermally or strong enough to photothermally tighten this layer. As for the rest, I'm confident that it works. Step 1 is a tightening of the smash with the piano. Now, please take note that each of the 4 steps actually performed with the L Runner Pro in the original protocol from China. Do not worry if you do not have a L Runner Pro scanner, as I will show you not just a modified, but an enhanced version of the same protocol or the same technique. The air cooling is used for epidermal protection so that more energy could be delivered into the deep structures. If you have a Dynamis Max, congratulations, because that cooling will work so much better and the result will be more effective compared to the conventional Zimmer cooling. The step 2 is a fat. Now this is done to eliminate the migrated fat. We know that we could not reposition the fat non-surgically. So please don't tell me about thread lift, okay? I know a lot of people still talk about thread lift. I have stopped practicing thread lift for many years now as any fat reposition from the thread lift is very temporary. So when we can't lift it, what do? We get rid of it for good. And we know that the fat reduction restores a better contour. It actually serves more than this purpose. Imagine a patient like this requesting a facial tightening. Any single dermal treatment by any energy-based device won't be enough. The weight of the migrated fat, it exerts a downward pull, so it's antagonize it. That's why the monotissue tightening gives very limited results. However, if such patients undergo multi-dimensional tightening with a concurrent laser lipolysis, the outcome is different. As the counteractive weight now is reduced when the fat is gone, the effect of the tightening becomes more apparent. You agree on that? I'm sure you agree on that, okay? That's exactly where Super V starts to make sense. It integrates both the tightening and the fat reduction for the lifted, a better defined contour. So the step 2 is more than just a simple lipolysis. It is a process that we call it as a hyperthermia induced adipocyte apoptosis. Franco studied on this and found out that adipocyte viability drop when the cells are exposed to either high temperature or on longer exposure time. Hence, now we know that the apoptosis process is a time and temperature dependent. Maintaining the optimal subdermal temperature is key to induce apoptosis, a slow but a permanent form of the fat reduction, ensuring a lasting definition. If you're using a DMC cooling for such adipocyte apoptosis or the lipolysis that you call it, okay, your basal temperature within your fat layer is actually has been proven higher than when you use a Zimmer, and therefore the DMC produce a better lipolysis whether on your face or even if you're doing a lot of body contouring with the type sculpting. This is a study that was done by Shen Wu in China using the same Fotona system that we have. As expected, the reliable lipolysis is achieved using the piano. Application of the air cooling, it delivers a better result. Okay, as we fully aware that the continuous piano with the concurrent cooling could achieve a higher subcutaneous temperature with the simple fact that there is a cooling of the epidermal and your body will be able to absorb more energy underneath the adipocyte. The step 3, it targets the retaining ligaments on the face to restore the vertical lift and the countering the mid-face descent. This technique has a beautiful name. It is called the Cupid lift. You see here the Cupid lift, okay? As there are 3 groups of ligament, each with a different actions. The distribution, you look at this lady here, and then you noted the white line, okay? So collectively, the distribution of these ligaments actually looks like the shape of the cubic bowl, and they call it as a Cupid lift. So firstly, the opercularis retaining and the zygomaticus ligament that run at a horizontal plane at the infraorbital and the malar area, okay? It looks like a belt, so they call it as a belt lift here. Secondly, the platysma auricular, the suspensory platysma, the mandibular and the buccal-maxillar ligaments that form a shape like a pocket. Lastly, a vertical line known as a sling that involves our temporary ligament adhesion, our lateral orbital thickening, our zygomaticus, mesenteric, cutaneous, and mandibular ligament. So again, the treatments involves a piano with the cooling. And finally, the step 4 is for dermal remodeling without the air cooling. Now, this complete the multi-layer tightening approach from deep to superficial. Look at some of the fantastic results produced by the Super V. Now, this is done just in a single session. Now, you could observe a better contouring with the tightening of the lower face. The migrated fat, once reduced, it could show a better lifting of the face as well as an enhancement of both the front and the side profile of the patient's face. Next, yeah, you check out this impressive result by Professor Tianyan Li, I think from Beijing. Now, tissue changes may look subtler, but the aesthetic transformation here is profound. And we bring back our Starbucks curve, you will see how the folding degree beautifully defines a facial attractiveness in this case. Now let's appreciate another group of the improvement. As impressive as these results produced by the Super V, I think the original protocol has some weaknesses, which include the absence of standardized quantitative measurement of the energy or the laser pulse that are needed. Furthermore, for those who do not have any L Runner Pro, they could not replicate the same. Okay, therefore, as promised earlier, you can snap, do a picture or something. This is the enhanced version of the Super V. Because it's enhanced, I just call it as an enhanced Super V. Okay, that I work with the R34 handpiece. If you buy your Dynamis Max, you know that is your R35 handpiece. You could use either 15 or the 20 millimeter spot size. Okay, with all these parameters that we set by default here. Now, why we need to use a larger spot size 15 to 20 is we want to deliver the energy deeper. Now, I found the large spot size works a lot more effective. Furthermore, the new DMC, the Dynamis Max, it produces a self-regulatory temperature, okay, as opposed to Zimmer, who could reach all the way to negative 30 degrees Celsius. So air cooling lead to energy wastage, a lot of them. DMC has been proven to achieve a more effective lipolysis earlier that I've discussed, and in my opinion, tissue tightening too. Also, in this enhanced protocol, I list out the number of the laser pulses, okay, not pulses, laser pulses that require to achieve the minimum result, which gives you a good control of your clinical endpoint. Now, with 20 millimeter spot size, what you see, instant lifting. Don't be shocked as you go back to office tomorrow. You try it, you fall in love with me, okay? Sorry, not me, but I mean your Dynamis, okay? And as a nutshell, the aging involves various layers of your skin, and Super V is a multi-layered, multi-dimensional tissue tightening and the facial contouring that is fast, safe, and effective. Now, we will take the questions later about the Super VS. Now, we just move on to our next topic, okay? Which is the periorbital tightening, non-surgical eye bag reduction, and then the periorbital rejuvenation. Now, there is an old saying that say eyes are the windows to one's soul, which show that is such an important aesthetic determinant in the overall human appearance. But because of this lack of the subcutaneous tissue and at the site with the most excessive UV exposure, that periorbital region is one of the first structure that shows signs of aging. The problem often complained by the patients include the ptosis, the dermacollesis at the upper eyelid, the dark eye circle, the eye bag, as well as dynamic and static lines. Erbium yak is novel. You guys know more about erbium yak than me, okay? Now, because of its high water affinity, it is associated with the most efficient ablation. The downside is because of the lack of adequate thermal coagulation, tissue tightening is limited. Fotona overcome this by introducing various pulse duration within your erbium yak. When the pulse durations increases from 0.1 to 1.5, the erbium yak could change its capability from the cold ablation to thermally induced coagulation. This is exciting as having such varying pulse durations like the Fotona, one could now achieve a full range of clinical indications You also notice about smooth mode here, okay? Now, smooth mode is perhaps the most important tool in my practice. I change my flash amp probably every 5 to 6 months once, okay? Probably more shorter than that. It is a very special pulse that made up from a fast sequence of low fluence Erbienberg pulses in an overall super long pulse at about 300 millisecond. Now, at this pulse duration is longer than the thermal relaxation time of the epidermis. The net effect is a coagulation without any significant frank ablation of the epidermis. For the most optimum skin tightening, it is always debatable that what is the best parameters to achieve so. Is higher the energy better or more stacking better? Now we actually have an answer now because they are both equally important. The most effective tissue tightening depends on the intense heat shock biomodulation or IHBM, okay, which activate our heat shock protein and extracellular matrix that give the immediate tissue tightening, as well as hyperstacking for deep hyperthermia for delayed collagen and elastin synthesis. So that gives you a longer result. When you combine both the technique, that is when you could achieve the most paramount, immediate, and sustainable tissue tightening. This cohort study was published by Dr. Badavi on periorbital rejuvenation with a smooth mode. He treated 30 patients with a smooth mode that followed both the IHBM and the hyperstacking hyperthermia technique at 4-week interval. And at 12 months follow-up, 12 months follow-up, is 1 year later, there is statistically significant wrinkle improvement with the Fotona smooth Erbienberg. Smooth Eye has achieved quite a marvelous, very marvelous, look at that, periorbital wrinkle reduction, skin tightening, and reduction and lightening of the eye circles. Upper eyelid. Upper eyelid is always challenging due to very thin skin and close proximity to our eye globes. So Fotona Erbienberg is a game changer. Very remarkable eyelid tightening that you could observe here. Okay, now let's move on to the eye bags. Okay, what you see here, there are a lot of eye bag. Okay, now because of the shadow at the inferiorly, patient often complain of dark circle, which is associated with the eye bag. Okay, now as the age advanced, we started to develop this loosening of the infraorbital septum with a receding orbital bone. When this is further complicated by the overlying skin loosening, the infraorbital fat could bulge outwards, giving rise to the eye bags and making the tear trough and the dark circle more obvious. Hence, to non-surgically, now I need to repeat, non-surgically reduce the appearance of the eye bags, it's important to note that we need to treat both the overlying loose skin and this herniated infraorbital fat. We talked about hyperthermia-induced adipocyte apoptosis earlier. Now, this serves as a principles of our fat reductions, in which led to the concept of tightening the skin and banish the fat in and out for eye bag reduction. The treatment consists of tightening of the periorbital skin as well as infraorbital fat reduction with the infraorbital transconjunctival smooth and also the dermal piano. Transconjunctival smooth is a procedure that is popular in my practice. I understand that this is not a common procedure that is performed in Canada, so please check with your local authority and the distributor if you do so. Also, this procedure requires significant experience and the use of ocular shield. If you are being trained to perform this transconjunctival technique, please always use your ocular shield. I know it's a tedious work to do, and I also know that the ocular shield will need to be autoclaved. But if you would really want to perform this, we will just have to, ensure that the compliance is in place, and it is actually very satisfying result. Okay. Now for transconjunctival smooth, we need to exclude the patient who are contraindicated to general razors, any prior lower eyelid surgery, Okay, why is it so? Because we are pulling down the skin. If the patient have any prior lower eyelid surgery, or if there's a scarring that might occur, they will blame on you. Okay. Also, you need to ensure that the patient do not have any corneal surgery about 6 months prior to the procedure, and more importantly, like any non-surgical approach, this procedure only indicated for patient with mild to moderate eye bags, like the 3 pictures that I'm showing you. When you're dealing with the advanced or very severe eye bags like this is not going to work. Patient require a surgery, okay, not a laser. Realistically, most patients should see the result after about 6 to 10 treatment when it's done right. Treatment interval of 6 to 8 weeks, there is really no evidence to support that a more frequent treatment is better. Smooth eye bag reduction is a heat-dependent procedure, and pulse stacking is crucial. In some cases, there might be worsening of the melasma due to the heat-induced inflammation. If this risk is preempt to the patients and with the proper melasma laser follow-up, it's not something that I would worry. I would tell the patients, melasma worsening is temporary, but your eye bag is forever. Okay? Another amazing work by Smooth. For non-surgical approach, tightening of the overlying skin is very important to hold and to push this protruded fat backwards and keep them in place. Okay, which you should not overlook the skin tightening. Now, look at this. If I tell you this result is achieved after one session of the Smooth, would you believe that? Of course you wouldn't, as this is not realistic at all. Adipocyte apoptosis would never respond this way. The initial presentation of this lady is likely some form of lower eyelid edema, but somehow disappear after the Fotona, eye, because of the enhancement of the circulation, both of the vascular and the lymphatic. Okay. Another common complaint is the dark eye circle, and in this case, it's caused by vascular congestion that is simply idiopathic, might be run the family. Now, we found a very interesting phenomenon. The transconjunctival smooth eye could almost instantly reduce the vascular congestion. What we believe that the photothermal energy facilitates the vasodilatation that could improve the circulation almost instantly. Besides that, the laser energy, okay, strengthens the endothelial wall for better contraction of the blood vessel, which could further produce a more sustainable result. And not to forget that neocollagenesis to improve the skin thickness is very important to reduce the visibility of these underlying vascular causes. Now, this is a typical case of chronic sinusitis-induced dark eye circle, evidenced by the vascular congestion and the infraorbital edema. Traditionally, the reasonable next course of action would be treatment of the underlying sinusitis, referred to the ENT surgeon, and the HA filler injection. Injectables only mask the appearance of the dark eye circle and make no contribution whatsoever in reducing the underlying vascular congestion. Okay, even you are using one of these brand new uh, collagen with the peptides or the whitenings or whatever they put in there. Okay, so if you're using injectable, the result is going to be short-lived. Excuse me. So in such instance, the Fotona laser is actually my first choice of treatment, even for this, chronic sinusitis-induced dark eye circle. This is another similar case of chronic sinusitis with visible hyperpigmented ring that improve with our infraorbital transconjunctival smooth eye. This technique, again, for us, a good substitute to the HF filler. Now, the last part of my presentation, I would like to just point out that this a very commonly made mistake when dealing with the dark eye circle amongst darker skin types. Now, if you look at patients like this, I think the sensible way that one always do is use a low fluence, Q switch laser toning, right? Knowing that this is a safer approach, but do you know that it's actually not a wise move? Because what happened was low fluence laser produces limited result. This would likely influence the operator to step up the fluence, the laser stacking, and the number of passes that they deliver. So when this happens, the gouted hypopigmentation will develop secondary to the accumulative laser toxicity on the melanocytes. And the hypopigmentation has an extremely fast onset beyond most our control. We know that the darker skin type has more hyperactive melanocytes and more melanin deposits, which put them at risk or higher risk of the PIH and the hypopigmentation. Therefore, we should not depend solely on a Q switch laser for deep pigmentation. Combine it with a Fotona resurfacing. This is an excellent combo. It not only produces safe, better, more predictable outcomes, but also improves the quality of the skin. Now, I have come to an end of my sharing on the Fotona Erbium Black with various pulse duration. Okay, so we know that Fotona is safe, is effective, and is versatile for the periorbital rejuvenation. With a good patient selection, the Smooth Eye could achieve remarkable non-surgical and non-injectable periorbital rejuvenation. As I have promised, Teresa, I will talk a little bit about this melasma. Okay, now melasma is
Dr.
something.
Chia, before you go on to melasma, I just have one question for you, and I get this asked by a lot of people. If they've had filler improperly placed under their eyes here, do you feel smooth mode could help with dissolving that, helping improve that if it's done wrong? What are your thoughts on that?
Okay, so that is an excellent question. Now, it depends on what kind of the filler and the site of the filler that they inject. Now, most of the filler they inject on the superficial skin just to fill up the tear trough is made up of very soft filler with a low G prime. So when you then if they go very deep, just above their lower or infraorbital bone, those fillers is a bit harder. Is there an evidence to show that any heat can dissolve the filler? And I have not seen a conclusive evidence to point out that. However, in Fotona, a lot of the doctors, good experts, they have been using piano, okay, the piano as a form of correcting all these overfilled syndrome or inappropriately placed filler. Now, why the piano is better than the smooth? Because smooth obviously has a very low penetration depth, and the piano can go all the way to centimeter, and you could deliver a higher energy. The question now is, are we dissolving the filler or are we simply removing the filler? And I believe in the latter. But let me give you another tips. The next time if you see somebody with a superficial filler that is not happy, you could combine the piano with a high fluence Q switch using your MAQX, okay, or your PQX, because that photoacoustic component could helps to further enhance, okay, the result of your remodeling. And even in a very soft filler like the Redensity 1 or Redensity 2 that is placed very superficial, you apply our MAQX, you'll be surprised to see the filler disappear before your eyes.
Thank you.
Okay, so we moved on to our melasma. Yeah, so I see melasma every day. I know people hate it. I know that people love it. But for the melasma, we know that it has a very complicated etiopathogenesis at the background of genetic influences. It also has the abundance of elastosis, which is the collagen breakdown product with the UV aging. And we now also know that it is an inflammatory response because the evidence by the hypervascularity. There's a mast cell activation that disrupt our basement membrane and very complex integration between the melanocyte with the parenchyma factors of the keratinocyte, fibroblasts, etc. and etc. If we know so much about the etiopathogenesis or the melasma, believe me, this is perhaps the tip of the iceberg that we know currently. Over the next couple of years, this list will continue to grow because it's so complicated. If we just treat the melasma in terms of reducing the pigmentation, we are not going to get there. Do you understand what I mean? So we need to treat the underlying etiopathogenesis. And because it's so complicated, I need to simplify things in order to make all these things digestible and manageable. And therefore, I divide them into the 5 main groups. Number 1, you have the inappropriate activation of the melanocyte. Number 2, there's aggregation of the melanin and the melanosome at our keratinocytes. And you look at the basement membrane changes here, they are digested by the mast cell. And the basement membrane is supposed to have a smooth and a seamless border. But problem is that when this leaking or this damage done on the basement membrane near the melanocyte is supposed to face upwards. But now they face downwards. We call it as a pentulous melanocyte. So what will happen is that the melasma, the melanin and the melanosome, instead of going upwards into your keratinocytes, no, they start to pour the melanin downwards, and you get so much pigments and trapped within your dermis. And when people like to say this is the epidermal melasma or the dermal melasma, I think this is a wrong terminology to use to name the different types of melasma, because melasma, there's only one type, which is melasma, because you will find the melanin or the melanosome trapped within your dermis as well as your epidermis. So there's increased mast cell and the solar elastosis. Solar elastosis, this is a collagen breakdown product. There is a hypervascularity. And therefore, we now know that the melasma, based on this etiopathogenesis group, it is a chronic, means it's going to haunt the patients for a lifetime. You're not going to get rid of the melasma. You cannot cure it, but you could treat it and control it. It's an inflammatory premature aging hyperpigmentation disorder. It's so important that we need to repeat. It's a chronic, it's an inflammatory, it's a premature aging hyperpigmentation. Think about it. There are people who are using just a monotherapy of the laser toning to treat the melasma. What are they dealing with? They only deal with the hyperpigmentation. They do absolutely nothing to reverse the premature aging. Premature aging, what does it come from? It comes from the evidence of the abundance of elastosis. So in order to treat the melasma, you need to increase the collagen, you need to reverse the skin, and the inflammatory, you need to reduce the inflammation, you need to get rid of all these blood vessels as much as you can. And therefore, in the world of star worker, for the treatment of melasma, we have this 4-step protocol. Okay, and each of them, step 1, using our MQX or the PQX or the latest Pico Pro that you have. I'm happy to share the parameters if you're using a PQX or Pico Pro. Okay, so that is to reduce the melanosome, and you reduce your melanosome transfer. And you have a step 2 and the 3. They both works on the FRAC 3 and the Versa. The FRAC 3, okay, is used to reduce the inflammation, and the Versa here, it is a sports treatment to reduce all these visible telangiectasia. And why do we need to remove them? Because we want to get rid of the source of the inflammation for good. Okay, and lastly, you have the fractional Q switch using the FS20 handpiece or the frac tab, okay, in the form for resurfacing and the collagen stimulation. So this is a girl. You look at the left side. This girl had 10 sessions of pico laser monotherapy done in other centers. Not happy with the melasma. Is it something that, very severe? No, not severe at all. And I don't understand why the patients actually underwent 10 sessions of very expensive pico laser 755, the brand. So she came to us that we do the 4-step protocol, and this is a result after just a session. She's very happy. So what do you see here? You see all these source of the inflammation being the visible telangiectasia, the blood vessel has been removed. And when that removed, you see all these reduction in the rosacea, you see the reduction of the melasma. And this is also another one who refuse or any downtime, and therefore there's no frac that done on her face. So instead of 1 session or the 6 session, she requires about 12 sessions. Okay, we get there. We were there. And this is a lady, very inflamed, very extremely inflammatory hyperpigmentation. Look at that, 5 sessions, we cleared about 90% of the pigmentation. So melasma, if you continue to use a monotherapy, using your Q switch or using your pico laser, you are not going to get there. You are going to do 20, 30, 40 sessions and not get the results that we could achieve just with the 5 sessions, okay? What happened to this darker skin type? All we need to do is to reduce our fluence from 1.6, you look at that here, to reduce to 1.2, and we reduce the number of passes that is needed by the patients, then they will see result. Everyone see result. Okay, if you look at this picture here, the most striking thing you see, this is the two large spots here. Okay, this is at the background of the melasma, they are solar lendogens. So what I'm showing you here is that melasma always coexist with other pigmentation. If we continue just using the 4-step protocol, you are not going to get far. You need to identify each different pigmentation. You need to isolate them. You need to individually treat them. In this case, at the background of the 4-step protocol for the melasma, we also treat these solar lendogens. You see, it's gone. So that is my sharing for today. Okay, if you need like a full presentation or the sharing of the melasma, it requires about at least 40 minutes. Okay, I know I'm short of time because I don't want to keep you guys bored. You have a dinner plan coming up. Happy to take any questions from here.
Thank you, Dr. Chia. I really appreciate the talk and always adding in melasma. I mean, people treat it, they get frustrated. You treat 4 people and think you found the cure, and then number 5 walks through the door, and it's a different case. Everybody sort of gets their own sort of treatment. So really appreciate that. Do you find when you treat melasma, you do a lot of hydration first or during, or that you want them really hydrated to do it, or you just rely on your Star Walker to target the melasma?
Any hydrations is fantastic, okay? Any skin, regardless whether there's melasma or non-melasma, the skin will need to keep hydrated, will need to be kept a proper care in order to withstand the trauma, from the laser. After all, we know that what is laser treatment? It is a destructive construction. You need to destruct something in order to reconstruct, your result. And in the event of the melasma, hydration and de-inflammation, they are important. Any dehydrated skin that undergo the laser, you are not going to maximize the result, number one. Number two, you are going to induce a lot of inflammation on a very dehydrated, very frail skin. And this is why you don't get the results, because of the inflammation.
Another question is, have you ever used ablative procedures when treating melasma instead of just the Star Walker? Have you used your erbium to target melasma as
Excellent.
well, an ablative?
Yes, excellent question. Because I just come back from Melbourne. One of the things that I just put 2 slides using that. Yes, there is a role of the erbium yak in treating the melasma, but this is actually very professional. It's very advanced technique. Okay, now where does it come place is that the rationale we use the erbium yak laser for the melasma is when nothing else work. Then you could use the erbium yak. The mechanism behind the erbium yak is, number one, it is a photothermal resurfacing. Okay, you just want to flush out all these pigmentation. By understanding that, okay, so what are the criteria or what are the precautions that we should take? Number one, melasma hates heat or hates inflammation, and therefore the pulse duration that you choose for your erbium yak, it should be just MSP. Okay, MSP. Number two, because of the mechanism is to resurface or to flush out the pigmentation, it should be reserved for somebody with epidermal predominant melasma. Number three, going back to number one, which is the heads of the inflammation, we would need to know how much to drill at the right top of your interface when you're using a fractional erbium yak. Okay, you will see the depth of the ablation and the depth of the coagulation. You usually choose your depth between about 50 to about 70. That translate into your fluence around about 18 to about 22. MSP, erbium yak, FSO1, or T runner. Okay, so why 50 to 70 micrometer? Because that is the depth of our epidermal dermal junction. So you want your erbium yak laser just to reach above your dermal epidermal junction in order to reduce or to minimize the inflammation that could potentially worsen your melasma.
Wonderful. Okay. There's
I'm
one
not sure
final
how much you guys
question.
can take in, huh? 'Cause there's a lot of things.
Yeah, one final question being asked here is, would you go through Smooth Eye when you're treating Fitzpatrick's 3 to 4 to prevent any hypopigmentation when you're using Smooth Eye? Are there risks? Like, what do you try to avoid for skin types 3 and 4?
Okay. No, even I could safely use smooth eye for somebody with a skin type 5 or 6.
Mm-hmm.
There's no problem at all. I think what people are worried is that yes, the darker the skin type, the higher the risk of the PIH. But the smooth eye, if you imagine that the smooth eye, you are essentially deliver your energy around about 100 micron. Okay, this is hardly reach your the lower part of your dermis. Okay, a lot of problems happen where people do the smooth eye using a full beam R11.
Right.
Okay, where you are exposing so much heat within a small area. So you need to be careful with your fluence. Number two, you need to be careful with your stacking. That is
Mm-hmm.
where the problem happen. High fluence, high stacks, and the next thing you know, the patient go back couple hours later with a blister. You don't want that. If you have practiced using the protocol, using a PSO3X, smooth spot size 7, the fluence about 3.5 to about 4.5, you do about 3 to 5 stacks, okay, you are generally safe. And then if you really worry about the risk of PIH, you could prescribe the patient a little bit of the topical corticosteroids, like in the form of betamethasone 0.1%, just for about 3 to 5 days, twice a day. That will reduce your fear of your PIH. Now, Teresa, you asked about the fear of hypopigmentation, correct? So the hypopigmentation happen when you have an excessive melanocyte damage. So that could come from the Q switch toxicity that has been overused. But in the event of the smooth, unless you are causing a huge blister, deep blister, then you might run into the risk of the hypopigmentation. If you could avoid that, it is safe.
Thank you. I have one more question someone's asking here is how many sessions and generally how far apart are treatments for melasmas for skin types 4 and 5? Any possibility of it getting worse?
Yes, there's always a big possibility that it got worse. Let me just give you a realistic timeline that how I would consult my patients. I will tell them that look, you will need at least 5 to 6 treatments, okay, sessions, which is done about 3 to 4 weeks apart, for you to start to appreciate the improvement. Okay, you will need about 10 to 12 to see good result. You might need up to about 16, okay, in order to achieve your desired result. And after that, you can go on the maintenance, either at home or you can come back here every few months once if you think there's a darkening. Now, why do you need a 5 to 6 treatment session is I don't know your skin, you don't know my skill. Okay, I got to understand your skin. Whatever parameters that works for the previous patient might not works on you. So we need the first of the 2 sessions, okay, in order to fine tune the what is suitable for you. There is always possibility of the worsening of the melasma because you cells are exposing, okay, to a laser. Okay, they are struggling before they die. So it's the energy I put it for them. So worsening of the melasma is expected. When you look at the algorithm, I've not presented to Canada team, right? Okay, so there is an algorithm. We need to test the skin. If there is a worsening in the result, we know that the patient would not be suitable for that fluence, and therefore we need to reduce that. Okay, so even the background of the 4 or the 5, you will see the result. Give them a proper timeline, a very practical, realistic timeline, 5 to 6 sessions before they will start to see the improvement. And then worsening of the melasma, acne breakout, they're all expected and they only gets better. I think one of the very powerful words that I like to convey to my patients is that there is no such thing as untreatable melasma. There is only melasma that not yet been treated.
Well, that gives us hope because
Yes.
that's always the one that's most frustrating. There's one more question someone's asking, and then we will be ending the webinar. Thanks everybody for attending and asking these great questions. But the last question is, of course, everybody's fear too, is hypopigmentation. If you do something, and we know that if someone has used the 532 on someone with darker skin and, you know, hitting that and you get hypopigmentation, or from acne scarring and hypo develops, what is your go-to that if you caused hypopigmentation that you recommend that they should do to try to mitigate that and make it better?
When you have the hypopigmentation on the darker skin type for a very acute treatment, okay, like a scar revision, okay, you just need to improve your skin. You just need to suit your skin. And there's some of these melanocytes stimulants. I can't remember off my brain now. Okay, there's one of the cream, but I think it's quite debatable whether it works very well. So if that happened from an acute event like acute
Mhm,
session, they
mhm.
usually self-improve on over the 4 to 5 months, and there's nothing you can do about it at all. Okay.
Okay.
However, if you're looking at this gouted hypopigmentation, that is happened in the spots from overuse of your Q switch, more so on the darker skin type or on somebody who has a melasma. I'm afraid to tell you there is no treatment for that. There's
Great.
absolutely nothing you can do. But I'm happy to share with the use of the erbium yak in order to mix the color difference between the white spots and the darkening area less obvious. Okay, we could use the erbium yak to achieve that.
Okay.
Mhm.
Well, what a pleasure to have you speak for us, Dr. Chia. That has been absolutely amazing. Everybody that owns a Fotona in Canada absolutely loves it, and they're always a thirst to learn from everybody that uses it, just to see what's new, what's happening, what they can add to their practice. So thank you for spending that time with us this morning for you, this evening for us. We really appreciate that. And yeah, I think that's where we're going to end it tonight. And thank you,
Thank
Dr.
you.
Chia, again.
Thank you, everyone, for your patience.
Thank you. You have a great day.
You too. Thank you.
Okay, bye-bye.
Bye.